targeting the side hip. We'll call it glute med, but we're also going to be getting the glute and hamstring here. And really what we're focusing on is using gravity to simulate just a little bit of that stance phase activation that we're looking for when we walk, right? So kind of that posting sensation or balance of one leg, okay? So for this exercise, we just need a couple of foam blocks here. We're gonna use one for our head and the other one's gonna be a target for our foot. As we come down, we're just gonna rest our head down here. We're gonna get the top leg resting on the foot as support. And then we're gonna bring the bottom leg up into a 90-degree position here. So as we look down our body, we wanna line ourselves up so our leg is in line with the top of our pelvis, in line with the foot, and also in line with the torso here as much as possible. And then we're focusing on this down leg here. We're gonna actually pull ourselves forward and over. So we're gonna roll a little bit towards the down leg. Okay. Once we're here, we're just gonna find a good comfortable position for our head. We're gonna focus on the up leg. You're gonna take a big deep breath in. You're gonna pull your toes up and then you're gonna push that knee back to lock out that quad. Once you've got that done, you're gonna work on tucking that pelvis. Okay, so wherever that balance is between locking out the quad and tucking the pelvis, because sometimes the two don't work together quite well, right? But what we're trying to do is we're trying to get the pelvis to be pulled up against the femur here as we lock out the quad. Take a breath in, exhale, keep the squeeze of all that going, and then find a bear hover off the block. And we're just gonna hold right here. You may feel some activation on the inner thigh of this down leg here. That's your midline trying to stabilize your pelvis as you hold this leg up in space. We want that. That's good work. Okay, you're going to still focus on this leg here, pulling the toes up, focusing on getting that quad staying active. And then very gently, I want you to just imagine you're pushing your heel down and away from you. Right? So as you pull your toes up, you're kind of reaching that heel towards the wall away from you, maybe a little bit back. You're driving more tuck of the pelvis. And you're breathing nice and slow for 4 breaths. Good. Check in, make sure you didn't roll away from that down leg. There should be a good amount of work on this down leg here. You're not going to feel too much up here quite yet. Okay, so you're still squeezing and holding, still reaching. Should still feel a little bit of activation up in here. Most of it's going to be here for now. Good, one more good breath. And parachuting down, nice and slow. If you notice at any point in time that you tend to turn your foot out a little bit when you're trying to hold that up there, that's a compensation or a bias. And we actually want to make sure that the toe or the foot is either pointed straight on so that we're holding kind of a neutral femur here, or maybe even just a little bit slightly internally rotated to get that glute med and maybe even bias that TFL just a little bit. Okay, so we're going to take a breath in again, making sure that we're rotated towards that down leg, exhaling, squeezing, locking everything out and finding that bear hover, maybe that little bit of rotation here, and then we're holding. Nice big deep breaths. Keep checking with all of your squeezes. Run the circuit. Keep that bear hover. Turn your attention to all the parts of your body that are working. Feel your quad. Feel that side hip. Feel the hamstrings. Feel the down leg. Might be pressing down a little bit to try to stabilize. Might be pulling up a little bit to stabilize. Either way, that leg is working. Good. You got one more breath here. And parachuting down nice and slow. So on that second set, you should have felt a little bit more work kind of up in this side hip, maybe even in the adductors on this leg as well, because we're starting to enter that endurance point of those muscles acting as stabilizers for the pelvis. Right? So we're just going to jump right in again with just that limited rest there. Take a breath in. Roll towards that down leg just a little bit. Lock everything out and find your hover. And now we're just going to get some nice, good deep breaths. But we're going to add a little bit more challenge to this last one. I want you to think about bringing your leg back just a little bit, right? Almost like you're trying to reach your heel behind you towards the wall. Okay, you may feel your pelvis tilt forward just a little bit. If you want, you can put your hand on your pelvis and kind of get a sense of where the front of it is, and then just tuck just a little bit more, holding your femur in the same position that it was, and you may notice that there was a little bit of a shift there, where the pelvis wanted to tilt forward as your leg went back. That's also compensation, and so we want to make sure that we're adjusting for that. So really focusing on that tuck, rolling towards that down leg, blocking out that knee, pulling those toes up and reaching that heel back as strongly as you can. Okay, and we're holding for 4 breaths. Good, and you can see my shaking here just a little bit as the muscles get tired. We're looking for that. We want to try to control that shake and smooth it out, building up that control. We got one more breath here. And parachuting it down nice and slow. Good, go ahead and roll away from that down leg, getting it out of that position, straightening it out, and then just go ahead and give those legs a shake. And then we're gonna roll over and we're gonna hit it on the other side.